Hello, good morning. My name is Kanwall Qayyum. I'm from Capella University, and I'm here to present a healthcare organization analysis report on Kaiser Permanente, a managed care organization. Today is December 17, 2021, and here is the analysis report. To first start off with Kaiser Permanente, before we get into the analysis of the organization, I wanted to point out the mission and vision of the organization, because this mission and vision is what's rooted into everything Kaiser Permanente does. Kaiser Permanente's mission is to provide high quality, affordable healthcare services and to improve the health of our members and the communities we serve. You would notice the word members in here. Kaiser calls its patients members because they want the patients to feel that they are part of the organization. Later on, I'll talk about a patient engagement system that they have put in place where patients could um, provide their opinions and their experience from which leadership could take that and make changes within the organization. Kaiser wants their patients to be members because they can kind of derive how and what type of healthcare that is provided to them. They are listened to, they are taken care of. Starting off initially, let's do a company overview. Who is Kaiser Permanente? Where did it start from? Kaiser Permanente has been a model for healthcare for over 70 years. Its inception in 1945 at a shipyard in Oakland, California, just began a new trend within healthcare. They became one of the first managed care organizations, providing their own health insurance, providing their own hospitals, and providing their own medical offices or outpatient services. Kaiser Permanente is made up of three entities, two nonprofits, which include their Kaiser Permanente Health Plan and also their Kaiser Foundation hospitals, and then one for-profit entity, which is their Permanente Medical Group. That's where all of the providers or physicians belong to. Kaiser has three key components to delivering care, and you notice that in the mission. Access to health care. They want to make sure that their members have access to health care anywhere they go. Quality of services and cost effectiveness. This type of service they receive, it should be of quality and it should be affordable. Moving on to analysis of a strategic initiatives. Kaiser Permanente is a physician-led holistic care. As I referred to, it's an integrated healthcare system. It's led by physicians. There are certain leaders that drive the organization from a strategic perspective, and there's physicians that are allowed to focus on patient care. They base their care and their mission and their practice around innovative technology. They were the very first ones to discover penicillin medication. They are continually always looking for innovative technology, better ways to enhance care. They're integrated and interconnected, providing services from primary care to laboratory to pharmacy to specialty care, physical therapy, member services, etc. Their access to healthcare is really important for them. If there are no Kaiser services available in a particular area or where the members live, they contract with other hospitals so that those services can be provided. For example, if a certain city only had medical offices, Kaiser then contracts with local hospitals so that those members or patients can go to the emergency room at those local hospitals and not have to travel far to Kaiser hospitals. The quality of care. The quality of care is consistently measured. Not only, and we'll talk about this later, not only they're measuring it because they're required to measure it, but they measure it internally as well by metrics. They need to know how well the patients are doing, how well their processes are, so that they can put performance improvement projects in place to address that. They have quality of care initiatives. Again, performance improvement projects that help them enhance their care. Cost effectiveness. Kaiser Permanente has to offer a certain number of services to their Medicare and Medicaid population. But in addition to that, they're not one of the most expensive health insurance companies as well. Their rates are competitive compared to other managed care organizations, utilizing other professionals such as nurse practitioners and physician assistants in their urgent care centers or in their emergency rooms helps them bring the costs down by providing care through other medical professionals. And when there is a shortage of physicians throughout the United States, and collaborative care. This is a key component to their health care or health plan, and that is because it's an integrated system. Collaborative care is provided. For example, a patient who's having a stroke comes into the emergency room. Immediately, a neurologist is paged, a radiologist is paged, a emergency room doctor is available. Their specialty nurses are paged, and continuum care is paid, so that everyone could work together to take care of this patient. Pharmacy is alerted so that the medications are ready on time. That's a type of collaborative care Kaiser Permanente provides. Moving on with continued analysis of strategic initiatives, there are barriers to access, quality, and cost effectiveness. Every healthcare system faces this, and so does Kaiser Permanente. But Kaiser Permanente is always working to mitigate these barriers. What are these barriers? Inconvenient locations, expensive, it's confusing, and so how do we address this? How is Kaiser Permanente addressing? They are focusing on population health. There are many different group populations throughout our communities that may not have access to healthcare, may not understand how to get access to healthcare, may not understand their health plans. So Kaiser Permanente is working with local agencies, social workers, and other community organizations on population health so that they could address this issue of access and quality and cost effectiveness from a holistic approach. Again, back to their mission and vision. How do they provide care from a holistic view? What's the impact of the strategic initiatives? It's decreased services if nothing is done, and managing costs has been a challenge for Kaiser Permanente, especially as the Affordable Care Act was put into place several years ago. Because Kaiser Permanente is limited to bringing in members of Medicaid and Medicare populations, it has to rely on the government for reimbursement, and that's definitely impacted the organization in managing their revenue and managing their costs. When we go back to decreased services, one example of decreased services is that external factors like last year in 2020, the pandemic caused a halt in many of these healthcare organizations, and Hawaii medical offices, specialty medical offices were closed because Kaiser just could not continue those services. Moving on, now analysis of the organization structure. Their focus is on the organization structure. You have to make sure that your organization internally is efficient and effective so that it could provide the best type of quality of care, access to patients. It includes, the organizational structure should include elements to provide service delivery from hospital to home. And that's what Kaiser Permanente has implemented. Their continuum of care department does that. If you're discharged from the hospital, nurses follow up with phone calls to see how the patient is doing, and even depending on the condition and what type of follow-up is needed, nurses do visit the patients at their home as well. The organizational structure within Kaiser Permanente begins with leadership. They have medical professionals, physicians that are in leadership roles so that they can bring in that clinical experience to leadership. The chief executive officer, the chief operating officer, most of these positions are held by physician leaders. Then they bring it down to, or bring it to another level, to having a chief nursing officer. So this nursing officer looks over nursing practices, looks over the nursing workforce. Why? Because when you have a chief nursing officer who's been in the trenches, they can provide a lot better guidance than someone who doesn't have that experience. They have chief administrators addressing all administrative work, from payroll to HR and legal and whatnot. Then they have care delivery leaders. Of course, you have those leaders in those executive positions, but then you have care delivery leaders that are guiding their fellow physicians on how to provide care, guiding the the nursing leaders are guiding their fellow nurses on how to provide this care and to keep with the idea of providing effective and efficient health care. And then there's, of course, market leaders who are looking at those market trends. How are we getting those patients into Kaiser Permanente? Do we have enough flow of members coming in? What is the market trend? How is this government? How is the culture changing? How is the society changing? Market leaders are looking at that. Within organizational structure, of course, we have different departments in area, from hospital operations to ambulatory surgery centers, utilization management, Medicare strategy, pharmacy, pathology and laboratory, legal. I mean, the list goes on. You have physical therapy services. You have supply chain. Supply chain in itself is such a big area within hospitals, because you have to ensure that the supplies are there on time. Analysis of our organization structure continued. So, what are the implications of this internal structure? How are we driving these results from a strategic perspective? How are we driving these results from an operational perspective? And when you think about that, you have to put things in place to make sure that this works. You have to put innovative ideas and changes in place to make sure that the strategic initiatives are met, that we are making sure that we're providing care, but we're also making sure that we're meeting our metrics. How do you drive these results from an operational perspective? You have to make sure that these processes are efficient, they're effective. Everyone is using similar procedures and similar processes. The more consistency we have throughout the organization, the better services we can provide, and the better organized the company stays. One recommendation to align the organizational structure is to come across with a patient-centered model. Kaiser has this implemented in certain elements of their business, or in certain elements of their healthcare organization. But what's important about this patient-centered model, or this PC model, is that the patient is at the center of the attention. Whether you're in IT, whether you're in human resources, whether you're in legal, you're there because of the patient. So your focus is on, how can I make patient care better today? Some of the things that have also been implemented or and can be enhanced within Kaiser Permanente is these patient-centered rounds or patient engagement. What that allows is that allows real-time feedback from the patients on what kind of healthcare delivery they're being provided. If a patient had a horrible experience with a nurse, they can communicate that to leadership, and the leadership could immediately go and talk to the nurse and explain to them what the standards of care are and what kind of care the patient should receive. Okay. Now, moving on to analysis of value-based purchasing and shared risk. Of course, we already know that healthcare organizations throughout the United States rely on funding from the state and local governments. There are four key components to value-based purchasing model. There is a clinical care, patient and caregiver-centered experience, efficiency and cost reduction, and safety. So these four components, it's necessary that healthcare organizations fall within these metrics that are published by local and state agencies. And if they fall within these metrics, then they get paid for the services that they provide, or they get bonuses for the services they provide. However, on the other hand, a shared risk model is payment based on the quality of care, but it allows for those hospitals that can't meet those metrics of the value-based purchasing model to do what they call a shared risk. They can meet a baseline, and as long as they meet this baseline, they can get funding. So those are the two different types of models out there. What are the implications of value-based purchasing on management practices and decision? There is a lot. Management is the key. Leadership is the key to deriving these quality metrics. They have to look at the data. They have to make insightful decisions based off of the data so that we can know that we need to limit that risk and maximize that gain. We need to make sure that there are no hospital-acquired infections. We need to make sure that the staff is doing what they need to do to provide that ultimate best care for the patient. What's the implications of shared risk models on management practices and decisions? Lack of alignment, not one size fits all. So the idea around this is that, like we had mentioned, if you can't meet those metrics, you can still get reimbursed, you can still get funding, but you have to make sure that there's processes in place that are going to enhance that care and provide that quality of care for the patient. Now, the next slide here is recommendations. What are we recommending for Kaiser Permanente to continue to thrive? Kaiser Permanente's motto is to innovate to transform healthcare. They have a nursing school, they have a medical school, they have research centers, they publish white papers. They're always thriving and working to transform healthcare. The three recommendations that impact the culture and that we're putting out there as recommendations are: recommendation number 1 is population health. Recommendation 2 is care pathways, and recommendation 3 is transparency, working on helping the patient population understand. Care pathways is effective processes, scripts that nurses can use when taking care of patients, and transparency, sharing the data and working on correcting the problems. In conclusion, I'd like to say that Kaiser Permanente thrives on innovation, innovative changes to address strategic initiatives. They are continually working on that. They continue to challenge those external factors that impact the healthcare organization. Their current and future management and leadership is a focus. They need good management and leadership to be able to continue to thrive. And changing times and ever-growing technology is what they're doing. Not only are they a part of it, but they take in what others are developing and innovate. Healthcare is ever changing. Consumers have a lot of information at their hands. They are coming in with preliminary diagnosis of themselves. So that's where healthcare organizations need to be flexible and need to listen to the patient to provide the best care possible by giving them access, quality of care, and making it cost effective. Thank you very much.